Welcome to NC Spin Perspectives, thoughts from opinion leaders in North Carolina. Talking with Dr. Conrad Flick, who is a family physician in private practice in North Carolina. Listening to your good friend, my good friend, Greg Griggs, with the Family Practice Physicians Association in North Carolina. We are going to have a shortage of primary care physicians of some 25,000 in the next few years. Why is this? Why are people not going into family practice?
Well, it's not a difficult thing to see. Over the years, if you go back to the 1980s, the salaries for physicians weren't that far apart. Now the average primary care physician, be it internal medicine, family medicine, or pediatrics, makes a third of what our specialty colleagues do. So the pay scales have gone up. So
that just doesn't make any sense. I mean, you're my first line of defense. You're who I go to when I've got a problem. So it would make sense to me that you would be the one who would be making the bigger bucks.
Well, the way it goes is we're paying people to do things. And people who do flashier things get paid more. I'm in what we call cognitive medicine. I do thinking. I don't do a lot of procedures, and we pay people to do procedures. But you're absolutely right when you talk about the overall cost and the quality of health care. A brilliant researcher, Barbara Starfield, years ago found out that the more specialists there are in an area, and in areas like Raleigh we are especially heavy, the higher the cost and the lower the quality.
And I'm not minimizing their importance. I'm just saying
neither am I.
You guys are the ones that I depend on for, what, 80–90% of the health care that I need.
And there's some good evidence out there now that the more you spend on primary care, the overall costs go down and the quality goes up.
Interesting.
But smart medical students look at this and say, I can work here and make this much money, or I can go over there and work harder and make a lot less money. You know, these are bright people. They figure it out. So I think if we want to improve the number of medical students going into primary care, you've got to change the pay system, and you also have to recruit the right kind of people in.
Beautiful segue into my next question. A lot of discussion about moving away from fee-for-service toward moving toward a holistic or whole care kind of care. Talk about that a little bit and why that's beneficial.
Well, I think it's, there are a lot of things about taking care of people that you can't fit into a 15-minute office visit. They can't be taken care of by a procedure. And so you have to look at that. And when you talk about whole care, we're talking about the biological stuff, the medical problems, the psychological stuff, the mental health stuff. We're talking about the social settings, and we're talking about all of those things together. Obesity and smoking and where you live and what your income level is and what shift job you work. There are so many factors involved that can't be squished into a 15-minute appointment. So I think for us, having some other payment scheme that pays you for other than just seeing the patient there. Can I manage them? And there are a lot of things called what are called per member per month payments, where you get a fee just to take care of all those other outside things, keep them out of your office. If I can handle it over the phone, or I can handle it via text or via an email, let me do that. But as of right now, I only get paid if they show up in my office.
Talking about pay, there's been a lot of discussion about the reduction in Medicare and Medicaid compensation. Doctors get paid reimbursements from Medicare and Medicaid, reductions in these fees. Some of this is causing some doctors to just refuse to see Medicare patients. What's going to take to reverse this trend? Just increasing the reimbursement rate? Is that going to do it?
Well, I don't think you're increasing the reimbursement rate, but distributing the reimbursement rate in the right way. Medicare has some new rules coming out about what we were just talking about, paying people to manage all those things outside of the office, so maybe we can keep that stream going and we can keep these people healthy without them having to come into my office or have them put it off too long. That's certainly one of the problems.
Is this what they call wellness programs?
Well, I think it's wellness programs. It's certainly just health maintenance programs.
Okay.
I mean, wellness may be exercise and smoking cessation, but there's a lot more to maintaining wellness and health besides just those things. So I think if we can look at those models, and there are some out there that work pretty well, but cutting fees for hospitals or particularly primary care doctors is really not looking in the right direction. I would like to see it shifted a little bit so we reverse the trend I was talking about that's given specialists much greater payment increase over the last 20 to 30 years than it has primary care.
Thank you for watching NC-SPIN Perspectives. We'll have more perspectives all during the week on ncspin.com.